When I was a GP trainee, one of our trainers, and this was pre-COVID of course, just for fun, decided to check vitamin D levels in all of his staff at the practice he was a partner in. He boasted how his vitamin D levels were 18 and the rest of the GPs working there were hovering comfortably around 20 to 30. And normal levels are thought to be over 50. Although doing these kind of random checks do not exactly fit in with the true indications that we would want to do vitamin D levels for in our patients, which I am showing you now on the screen from one of my favorite websites, CKS. And if you do want to see all the resources I use day in, day out as a GP, click on the link above. For those of you that don't know me, I'm Mike, a GP working in Manchester, UK, and welcome to Easy EMIS Blood Results Vitamin D. It is common to get vitamin D results in our inbox, and we should know how to manage them. The steps are: code the problem, send the script to the chemist, send the text message template with AccuRx to the patient, and create EMIS diary to recheck bloods after completing treatment. Now this is because CKS suggests to check the adjusted serum calcium level within 1 month after the last loading dose or after starting lower dose maintenance treatment with vitamin D. And you're doing this to detect calcium deficiency or unmasked primary hyperparathyroidism. Unmasked primary what? But if you do want to learn more about our EMIS diary system, which I would highly recommend for medical legal reasons, click on the video here. And I'll show you the AccuRx template you can use for insufficiency later. Now let me show you how to create a simple, well, probably simple, F12 EMIS protocol with an inbuilt template that will incorporate all of those steps with one button and a few clicks. Go to the EMIS ball in the top left-hand corner, go to Configuration, and Resource Publisher. If you don't have a folder here already, click on the Add folder, and you can pretty much call it whatever you want. My folders are typically called GP On The Move, and click Save. Go into your folder on the left-hand side, click on Add, and we're gonna start with building a template. So click on Template. In my template, I want to have the last vitamin D blood result. I want to be able to code the problem. And finally, I want to be able to add a diary. So to show that last vitamin D result, go into Information Components and Last Coded Entry and add it here. So in the label, I'm just gonna have it as vitamin D levels. And now you want to add the code to display by clicking on the magnifying glass. At this point, you need to know the exact code for the vitamin D levels that are coming in from your lab. And the best way to do this is to go into one of your real patients, find the vitamin D result, and find the SNOMED code and copy it. This is our SNOMED code for vitamin D levels. Now, if you don't know how to do that, again, I have another video that explains how to do that, and I'm going to show you on the screen right now. So I know that this is the SNOMED code. I just double click on this and click OK. Now what I want to do is add the problem, go to Data Entry Components, and Code Pick List. I want you to be able to decide whether the problem is vitamin D deficiency or insufficiency. Let's find those codes. Vitamin D deficiency, and let's add the code vitamin D insufficiency. Brilliant. And click OK. Now what you can do here is add a prompt, because it is difficult to remember those numbers. And what I have here is that if vitamin D is less than 25 or 30, according to the GMMG, that is a deficiency. And then if the vitamin D is 25 or 30, according to the GMMG, to 50, that's classed as insufficiency. Now, if you try to click OK here, you're gonna come up with an error that says, please specify a consultation section. And I actually want this to be coded as a problem. And click OK. Finally, I want to add a diary entry. From the data entry components, diary entry. Now you have to add a diary entry that your admin staff actually looks for. So I know that we look for a diagnostic blood test. And at this point, I want to tick all of these boxes. In the default text, I'm going to have recheck bone profile, which is calcium, 1 month after vitamin D treatment. And click OK, and again OK. Now the last thing I want to do is to signpost the user here that to access the prescription, they're going to have to save the consultation. And the way I do that is click on Template Layout Components. Let's add a new section here. And Information Components, Text Information. And I'm going to put here, please save consultation to access prescription if required. Click OK. Now you can save it here, but personally I like to tidy things up a little bit. You probably noticed that from the other videos. So in the new section 1, I'm going to change that to actually say code and add diary. And in new section 2, I'm going to right click properties, change that to prescription. Right, brilliant. So at this point, we can save and close. Go into your folder, and I'm going to call this vitamin D template. Brilliant, and save. Now, before you create your protocol, make sure that you activate your template by right clicking, status, activate. And you do want to activate this item. Let's do the protocol, and this is the super geeky, really fun bit. So click on add. Oh crap. Click on your folder, click add protocol. So this is where it starts. I personally like to move the start button a little bit away. And then I always like to add an end protocol button. And this is where we're going to aim to get to. The first thing you want to do is you want to launch the template. So go down to action nodes, launch template. And here you're going to have to find your template. So we called ours vitamin D. Oh, brilliant. Vitamin D template. There it is. Again, I like to move it to the side. Connect them with little arrows. Now we have the template here. If for whatever reason you want to cancel, let's just go straight to the end node. However, if you want to continue on with the protocol, we are going to ask a yes or no question. Go into decision nodes and drag ask yes, no question. And here's the question. Do you want to prescribe a loading dose of vitamin D? Click OK. Again, drag that a little bit closer. Connect completed to this. Now, if you do want to, we're going to add a drug. So action nodes, add drug. We use Hux D3 and we do 2 capsules every week, and that's 14 capsules. Click update. Now, if you do want to prescribe a loading dose, just drag the arrow to the add a drug. I don't know why I'm laughing. This is just like really fun. Once you've added the drug, you're going to have to send that AccuRx template. Now, unfortunately, EMIS doesn't integrate that well with AccuRx, so I'm just going to add a reminder here. And to do that, I'm going to go down to action nodes and display text. And this is the text I want to display. So please send vitamin D deficiency AccuRx template text message. So if you've added the drug, connect this, and then after that, you're pretty much done. Now, let's say this is an insufficiency and you actually don't want to prescribe any medication. Although realistically, you would probably ask why you're doing a vitamin D level in the first place if you're not planning to treat it. Because the guidelines say that if patients are insufficient but are symptomatic, you should still treat. Some people may not want to. So I'm just going to move this a little bit higher. We're going to go back to the yes/no prompt and add a display text. So if you don't want to prescribe a loading dose, you're going to have to send the vitamin D insufficiency AccuRx template text message. Click OK. Just going to move this underneath. And again, connect the no to the display text and connect the arrow to the end. The last thing you want to do, just to tidy things up a little bit, when you're in the add drug section, if you do change your mind, you can just cancel. So we're going to need to drag cancel to the end. Right, and that's pretty much our protocol. At this point, save and close. Click OK. Probably read the alert and then decide if you're okay with that. Go down to folder, protocol, and click save. As before, make sure that you click activate, right click, status, activate, and let's try it out. Add a consultation. Now, to activate protocols, you want to click F12. And what you could actually do here is add it to this list. So just choose a letter that you're happy with, right click and add, and now find the protocol that we just created. Right, so as you can see, this is the template that we created. Tilly Tester had a vitamin D done on the 18th of August 2022, and it's 18. So that means if it's less than 25, that's a deficiency. Let's add that problem, vitamin D deficiency. And as you can see, a diary has already been set up here. Finally, it says here, please save consultation to access prescription if required. So let's save the template and let's save the consultation. Do you want to prescribe a loading dose of vitamin D? Yes, I do. Click on yes. Yeah, she'll probably be okay. And then at this point, it has already brought up the Hux D3. I want to send the vitamin D deficiency AccuRx template text message. Let me show you those 2 templates. If you go into AccuRx, now this is a template that AccuRx already has built in. Vitamin D, brilliant, vitamin D deficiency. So your recent blood test shows that your vitamin D was low, blah, blah, blah. And here is a link so that you can read a bit more about that. Click to send. Now let's try doing it with the insufficiency bit, and you don't want to prescribe the loading dose for whatever reason, although you probably should if you are checking vitamin D in the first place. No. please send vitamin D insufficiency AccuRx template text message. So let's go into AccuRx and let's find the vitamin D insufficiency text message. Your blood tests show that your vitamin D is slightly reduced, so you can buy vitamin D over the counter and just send now. Personally, I will frequently check vitamin D levels in patients who have generalized aches and pains, and sometimes even fatigue, but that will depend on the individual patient. So, what are the guidelines and how can we make them work for us? Public Health England suggests that we should be getting enough vitamin D from the sun in spring and summer, but all people in the UK should be taking vitamin D supplements in the autumn and winter at 10 micrograms a day, which is 400 units. So if you've never taken vitamin D before and you live in the UK, well, this is something that you might want to bear in mind. CKS suggests that under 25 is classed as deficiency, and so patients should have treatment. Of note, GMMG, which is the Manchester formulary, have that cutoff at 30. And if you want to know why, then I suggest coming to Manchester. I would recommend reading the full guidance in the link in the description below, as there are some exceptions to the rule that warrant a referral. Lastly, although routine monitoring of vitamin D levels is not needed, there is a suggestion to consider checking levels 3 to 6 months after starting vitamin D treatment in people with ongoing symptoms. Right, that's it guys. I hope that was informative. Let me know if you have any issues, leave a comment below and feel free to email me directly. Otherwise, good luck.